Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults to were very creative.
Down on the floor and play with their kids.
AFMC TV. Thanks for watching. Have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers. He's the Chief Medical Officer here at AFMC. Thanks for being here.
Glad to be here.
So we're talking about the vitamin K administration. It's not a vaccination.
That's correct.
But tell us what it is and why it's so important.
Right. So vitamin K is what it is. It's a vitamin. So you think a lot of people know what vitamins are. They're kind of part of our nutrition that help with all the kind of things that go on our body for, to be healthy. So you think about vitamin K, like vitamin D, which is another vitamin that we often talk about giving babies, especially breastfed babies, the first couple of lives. Each one of those vitamins, the big ones, vitamin A, vitamin D, vitamin E, vitamin K, they all have, a function in our body. Vitamin K is particularly related to some of the clotting factors that we need in our body in order to stop bleeding. So that's sort of its essential function and why it's so important to babies.
And we often hear that it's referred to as the vitamin K shot.
Right.
So it is important for a newborn baby.
Right. Here in the U.S., we give the vitamin K shot because there's lots of reasons. We can talk about that more shortly. But it is something that's administered within the first couple hours of life. It's probably the number one thing that, when people say, oh, when the baby came out, they got a shot, we almost always know that that's the vitamin K. There is another vaccine that's given around that time, the hepatitis B, that sometimes people get confused with. And that's sometimes maybe why people think it might be a vaccination.
And there have been reports of increasing numbers of parents declining vitamin K for newborns. What trends are you seeing, and why is this getting the attention of the healthcare community?
Yeah, unfortunately, we are seeing sort of a trend towards people who are sort of refusing vitamin K, and for various reasons. It has gotten to be, just like with vaccinations, there's been just some distrust in the community towards not just, physicians, but just medicine and science in general. And that's something we've seen kind of across the board. But vitamin K is one of those things that's kind of given right out of the womb. And, a lot of parents, you're a parent, it's a big moment, and where you're really interested with the wellness and the keeping this thing alive, And so there's lots of decisions, lots of things. And people, having birth itself is such a natural part. It's, the continuation of humanity. People really want it to be natural. And so some people kind of feel like this is something, why would a baby need something right out of the womb? When we're trying to have this natural childbirth. And then sometimes people just don't want the baby to have pain, and it is an administration of a shot. So, but there's, sort of this overwhelming reason why we do it. And so it becomes kind of important to go ahead and give it and administer it.
So what are the potential consequences if a baby does not receive it at birth?
Right. Like I said earlier, so it's involved with sort of the development of sort of some of our clotting factors. So it's very important when it comes to bleeding. And so babies aren't born with a lot of vitamin D on board. There's not a lot of transfer of vitamin D from mom to the baby. It just doesn't cross very well across the into the placenta, across that little cord. And then also babies don't really, so when they're born, their gut's sort of sterile and clean. And so it takes a couple weeks for them to sort of establish this natural bacteria in their gut that you and I have that help us digest all sorts of things. But those bacteria sort of, as a part of their chemical reactions that they make to create energy, they produce vitamin K. And so that's not really well established in the first couple of weeks. So babies aren't producing the vitamin K in the gut that they need. And if they're a breastfed baby, they may not be getting as much vitamin K through the breast milk. So they're born with kind of low stores. There's a lot of things that go on through delivery. They pass through that canal. They have lots of procedures. And just day to day in life, we do little bumps and scrapes and stuff like that. And so bleeding, being able to stop bleeding is such a vital part of life. So it becomes sort of this essential thing.
And the deficiency, the vitamin K deficiency bleeding, it can be very serious.
It can be very serious. And what's unfortunate about it is that bleeding can occur and when we think of bleeding, we often think about what we can see, or we throw up blood, or maybe we poop blood, or we scrape ourselves. But there's other places where blood can collect. And one area is in the gut, and you may be bleeding into the gut and not realize it. Another is into the head. And so, and you can actually bleed quite a bit of blood into those spaces before you really start to see symptoms. So once people people have been already bleeding into those spaces, then what can happen kind of happens quickly. And then most of the time it's really too late to do anything, and it's really virtually impossible to reverse that bleeding.
What are some of the short and long-term outcomes that occur when a newborn experiences the VKDB?
Yeah, so there's a lot of things in the first couple of days of life, so there are heel sticks that we do, sometimes do newborn screen and stuff like that. So there are times when your baby's being stuck for things. Newborn males are circumcised. So, if you can't stop your bleeding efficiently, then that may lead to bigger things. But the long-term consequences where you do get like a bad bleed into your head or into your gut, ultimately those could lead to death. But for those that are able to be stopped or controlled, then you're looking at kind of some lifelong, maybe disabilities, neurological problems, seizures, that sort of things that you would commonly associate with like a brain injury.
So are there specific signs, symptoms that parents and even healthcare providers should be aware of or can see these bleeding events occur without warning?
Right. So a lot of times by the time a baby presents, it's really kind of gone a little too far. So, there are things that we obviously you can see bleeding. The baby has a bloody diaper or they vomit blood. But if there's, like I said, bleeding in their head or their gut and you just haven't seen it yet, it may just be irritability or not feeding well or not gaining weight or maybe just excessive sleepiness. So things that sometimes we also associate with things like infection, or is this some other newborn process going on? Babies can't tell us a whole lot. And because of that, because we've used vitamin K for so long, a lot of practitioners, when they see a baby that present with irritability or not feeding well, may not think about that first, because we kind of presume that everybody got the vitamin K because it has been so universally done since the 1960s. But it's something that we kind of have to consider now.
And what are the reasons parents most commonly give for declining it?
Yeah, I think a lot of times it's just misinformation, or maybe they just don't know. Every first mom always tells me they go into the delivery and they start putting all these papers in front of them. And, if you haven't really read about it, or there's so much you're trying to learn about as a new parent and trying to do everything right, that sometimes you just don't know what it is, and you may have questions, and I think those are legitimate questions. Some people don't want the baby to be hurt, so they don't want the stick, in the leg when they first come out of the womb, but it is kind of important that we kind of do it early. So if they want to wait, for a little transition time, I think that's okay. But usually within that first 6 hours. The other thing is there's just this growing amount of misinformation about vitamin K, and that it could be harmful, which we know that it's not. And so parents hear that and they can't really separate out the good from the bad sometimes. And so I think the parents' intentions and the mother's intentions are good. It's just a lot of times just bad information out there making the decision kind of more difficult.
And some parents ask about an oral version administration. Is that an alternative?
Oral vitamin K in the United States is not readily available, and it's not indicated for this. It's not very easily absorbed through the gut as compared to where we give it into a shot. So when you give it into the muscle, then it's absorbed into the blood and you kind of bypass the gut, so you don't have to worry about absorption. The other thing is that this deficiency can persist for a couple weeks. So we're not just talking about the newborn period. There's sort of that immediate, and then there's sort of that first week, and then there's up to 6 months that you could present with this bleeding difficulty. So you have to kind of administer it. So very early on, there's actually a couple of different regimens, but there's 3 kind of commonly used ones. But you kind of have to give it, immediately, orally, and then a couple weeks later, and then a couple weeks later. And in the newborn period, there's a lot going on. It's like, oh, I forgot. It's not like it's a medicine you're taking every day. It's if we do the shot, it's one and done. You don't have to worry about it anymore. With the other dosing regimens, you're really kind of introducing some complexity that most people, I would have trouble with it. So, even putting it into my iPhone.
So what does evidence tell us about the safety of it? It's an important.
We know it's extremely safe. When you think about it, every baby has gotten this since the 1960s, and we would know if there was a big problem. And we know that the risks are very low. There is some misinformation out there about its association with maybe leukemia and stuff like that. But again, we've been doing this for a long time. We have a lot of babies that have gotten it. We know that there's not an association, but those are the kind of things that we sort of have to battle sometimes.
So how can providers have respectful, productive conversations with parents who are hesitant or have health concerns?
Yeah, I think most of the time it's just trying to get a feel from where the parents are coming from and trying to be respectful. And then sometimes if they just, have a little hesitation, like I said, maybe we give the baby, 2 or 3 hours to try to transition and then do the shot. But really trying to give them the information. I think it's kind of sometimes a difficult position because you haven't quite developed that relationship with the parents yet. And so this is a lot of trust. So I think building a lot of trust in the community. I think when we educate parents, early on that this is a part of that education. Maybe it's something that other doctors like the OB-GYN or their family doctor or somebody that they're working with can kind of also answer for them.
So what role can healthcare organizations, public health agencies play in improving awareness and education around this?
Yeah, I think public education is still so important. And, I think kind of having the conversation, doing things like this, are kind of important to getting that good information and just continue to kind of put what we know is good information out there.
And are there opportunities to better engage families before delivery so they can make informed decisions?
Yeah, so since it's sort of in the area of prevention, so the earlier the better, which is always sort of the key principle of prevention. So I think, talking about this early on in the pregnancy, maybe visiting again for along, kind of addressing at the time of delivery, maybe within the first visit in the hospital, that these are really good times to sort of talk about it.
So before we go, what's the most important thing that you would like healthcare professionals, community partners to understand about protecting newborns through vitamin K administration?
Yeah, I think that it's still just very important, and that even people who kind of get away from their pediatrics sometimes can forget, why do we get that vitamin K shot at delivery? And that it's something, it's a vitamin, it's safe, it's effective, and it usually works best when we sort of universally give it to all. And so we don't have to worry about that baby that rolls into the ER at 6 weeks of age and we're worried about infection or we're worried about maybe abuse or something else. But now, knowing that could also be a risk factor, and that it's important to ask newborn moms, did your baby get a vitamin K shot at the time of delivery?
Well, Dr. Chad, thank you so much for being here and for sharing this important information.
Always glad to be here.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.